UMC Victoria Hospital, over the last 3 years, we have expanded our radiology department. We've put in a state-of-the-art MRI and CT machine. So in terms of diagnostics, we've really expanded. It's a one-stop shop. Prior to that, we used to outsource our MRI and CT services. Patients would have to be transported by ambulance to other facilities. Now we do that in-house. We opened up a new optical department and ophthalmology services. So you can have your eyes done, eyes checkups done. Because we had a department doing dentistry, but we realized that optical also, which is not so much of an emergency, but people are coming in and wanting everything done in one go while they wait to have their sort of ECG, heart services checked up with this long waiting list that want other services. So we provide an optical department where they can have the eyes done. We are currently at a very advanced stage of putting up an IVF unit for fertility services. So our equipment has arrived. We're installing it into our state-of-the-art lab, putting up an IVF center, which is growing in big demand within this region. I think worldwide, IVF services are being sought for. And then we were accredited to be another private healthcare facility for HIV, AIDS treatment services. So we've got two buildings, one across the other. So our main facility, the hospital, where we do all our inpatient critical care treatments, the one across the road, we started doing our elective services. So the optical department is there, physiotherapy, dentistry, which was there previously, but now we've sort of segregated the two departments or two facilities where you've got your sick patients, so to speak, in one area, and people requiring sort of more chronic day-to-day services, optical, dentistry, physiotherapy can go to the other department. We are also now opening up another 2 or 3 clinics. I said previously we were constrained in terms of capital, but our senior management now is very well trained. It's more automated now. Things are very much automated in terms of management services. So we are opening up clinics and facilities in other towns to to expand our outreach in terms of our services, but also to create the network, the brand, so that they can access, the people know more about our facility, UMC Victoria Hospital. We've recruited our intensivist, our orthopedic services. We have actually recruited doctors from Cuba, and most recently, one of our very good doctors, actually very well known, reputed in this region, comes from Sudan. After the issues that have been happening in Sudan, and we've realized there's several good qualified doctors. Sudan is a big country, Khartoum, huge population. So these doctors that were there have been trained or have had access to numerous pathologies, patients. They've got a lot of experience. Now, when they come out from there, maybe the language barrier is a problem, but some of them do speak English. And by recruiting them, we realized that they are actually very good in terms of the quality, their patient care, their ethics. So that has been very helpful. We have invested heavily into training. So we do a lot of online seminars, CMEs, continuing medical education, with doctors from India, subcontinent of India, come in and either physically or online hold seminars and training sessions. So that has really helped improve our local skill. So we've realized ultimately we can't rely always on importing our human capital. We do bring in a few, but we rely on training our local born, brought, grown, trained personnel in Uganda, whether it's doctors, nurses. The biggest challenge we do face really is on the nursing side. A lot of turnover on nursing staff, because the pool of nurses is small overall, and they can jump from one facility to another facility for as little as literally $50, $100 increase in pay. They would shift. So that loyalty is where we have the problem. But again, we're a growing economy, a growing nation. So $50, $100, which would be about, say, 200,000 to 400,000 Uganda shillings, is quite substantial in terms of a salary for the staff.